COVID-19 pandemic is largely being touted now as a pandemic of the unvaccinated. Countries that have high vaccine coverage are still seeing a spike in cases, but not necessarily seeing a corresponding spike in deaths. So, to make sense of all of this real-world data that's now available to us, and also to answer that very key question on why countries aren't lifting travel restrictions for fully vaccinated people with WHO-approved vaccines, we have Dr. Jerome Kim, the Director General of the International Vaccine Institute, joining us live from Seoul. Thanks so much, Dr. Kim, for being with us. You know, a red carpet is being laid out for some vaccines and some are being relegated to a red list. Is it time for fully vaccinated people with WHO-approved vaccine to be allowed to travel globally?
So I think it's very important to recognize that in many parts of the world, the regulation of the decision over which vaccines work and are acceptable in a population fall on the national regulatory authority. And so for much of the world, WHO serves the purpose of that national regulatory authority, providing the kind of expertise that is necessary. In other parts of the world, particularly parts of the world with stringent regulatory authorities, the highest level of function, the United States, the UK, Europe, Japan, their regulatory authorities may take a very different view of the approvals of WHO. So for instance, certain vaccines will be approved by WHO, emergency use listed, we say, but they won't necessarily be approved in the United States. The AstraZeneca vaccine is not yet approved in the United States. So again, from the perspective of the US government, those vaccines are not yet approved for use. And so they might have an issue with a person who says, I've been fully vaccinated with AstraZeneca.
Right. But doesn't it lead to vaccine hesitancy in a certain sense if a particular vaccine is, say, not cross-recognized in another country? And the reason I ask this question is because India, for instance, continues to remain on the UK red list despite the fact that we're vaccinating with the very same AstraZeneca vaccine.
Yes, and so it gets to which version of the AstraZeneca vaccines have been approved and where the vaccines are manufactured. So, again, as the regulatory authority for the United Kingdom, the MHRA has to be sure that it has been able to adequately supervise the production from a second site for AstraZeneca. And I think that's underlying some of the difficulty. But you get to a very important question, which is, we're going to have to accept that there are a significant number of vaccines that are out there in general use. And many of these vaccines have published data, have shown safety and efficacy. Many of them have been reviewed by regulatory authorities that are at least functional, and then further reviewed and approved by the WHO. And so there needs to be an international set of agreements that cover this. And unfortunately, that kind of agreement has been difficult to come by.
Right. But, you raise a very important point, and this is something that the Europe Medicine Agencies also raised about how the same technology vaccine could have differences if it's manufactured in different parts of the world. How does this work? Explain it to the layperson.
So it's, it's important to remember that vaccines are not like drugs. They're the result of a complex biological process that has a lot of control steps. And for instance, and I'll pick the mRNA vaccine because it's said that the Pfizer-BioNTech vaccine actually has 50,000 individual steps. And each of those steps has a series of controls that go with it. So you can transfer the ability to manufacture something, but you also have to make sure that it passes all the regulatory requirements. So for instance, and just to use cars as an example, there are certain rules and regulations that go into cars that are used in the United States that aren't necessarily used in other parts of Europe, for instance. Okay. So those cars have to be modified before they're sent to the United States and can be used there.
All right. Well, I think that's as simply as you could have perhaps put it. But, the other big story, which is about, the US coming out and saying that the global third wave is going to be largely a pandemic of the unvaccinated. Prima facie, it appears that deaths didn't rise proportionally to cases, especially in countries with a high vaccine coverage. What does the real world data about COVID-19 vaccine efficacy tell us at the moment?
You know, it's really kind of funny that this pandemic of the unvaccinated has come out as a meme, because it's really always been a pandemic of the unvaccinated. I mean, when you think about it. But it's absolutely true. In countries like the United States, a significant number of the new cases, and particularly those people who are appearing in hospitals and those people who are dying, are people who haven't been vaccinated. So in countries that have had, significant access to COVID-19 vaccines, it's those parts of their population that haven't been vaccinated that are proving to be problematic. In other parts of the world, and I'll just pick Korea, for example, only 35% of the people have received at least one dose of vaccine. So, and very few people have been infected, maybe 200,000 out of 51 million. So there are still significant populations at risk in these countries. And we know that you can use lockdowns, you can use lots of social distancing, you can impose all sorts of social controls and masks. But in the end, in order to escape the economic and social and humanitarian consequences of COVID-19, you're going to have to vaccinate as quickly as possible with safe and efficacious vaccines.
Right. So the real world data, has been encouraging in a certain sense, because while cases continue to rise, there hasn't been a corresponding rise in the number of deaths or even hospitalizations. But I want to ask you about another interesting phenomena, which is, whether it's the UK at the moment where the seroprevalence is high, almost an average of 1 in 75 people are testing positive or have tested positive for COVID. We're seeing a similar phenomena with states here in India, states which are reporting, a high seropositivity, are reporting a low number of cases, and the other side is also true. States with low seropositivity are reporting a higher number of cases. Is herd immunity therefore the only way out of a pandemic, and what more can you tell us about herd immunity as far as the global pandemic is concerned?
So herd immunity is an important idea, and it is absolutely true that when you hit a certain level of the presence of antibodies in a population, these infection-fighting proteins, that the ability of further infections to spread becomes limited. It doesn't mean that infections will stop. So, people are always wondering now, well, we've done all this vaccination, why are we still hearing about infections? What the vaccines actually do best is to prevent severe infection, hospitalization, and death. So even though if you're vaccinated, if you become infected, you don't suffer the consequences, the significant consequences of infection. It also means that, for instance, in the UK now, and everyone has their fingers crossed, they've opened up a bit.
Yes.
They're not seeing a significant surge in deaths or hospitalizations necessarily. So again, this is the real world evidence, the impact of vaccination on an entire population. Now, have we seen problems? Yes, there was a city in Brazil. They thought they were at herd immunity because of infections in the early part of 2020. In 2021, they had a significant outbreak, and lots of people got sick and died. So we have to be able to trust that the data that we're getting are correct and good. And that's going to be really important. I mean, unfortunately, this pandemic has always surprised us in the worst possible way. So, looking at the numbers from India, you'd think that maybe we would be at a relative state of herd immunity from natural infection in certain states.
I have two quick questions to ask you, and I have only 30 seconds left, I'm told. Do you think vaccines are going to have to be modified sooner rather than later to respond to emerging variants?
So right now, the vaccines that we have work against the variants that we know of. The problem is, of course, that these large uncontrolled outbreaks are the source of new variants. So it could be that, in the United States now, the new outbreaks that are occurring are generating variants that we don't know about that may be resistant. The Lambda variant in South America appears to have more resistance. So we have to keep an eye out for variants by sequencing the breakthrough infections that are occurring in countries, and also beginning to explore where outbreaks are occurring that we really don't have a good idea or a good measure of.
Right. Last question. The mask mandate has been reinstated in South Korea and in the US. What does this tell us? Masks are here to stay for the foreseeable future?
So it never disappeared in Korea. Despite 35% vaccination, they're still encouraging mask use and distancing. In the United States, the Delta variant is very worrisome. It appears that when you're vaccinated and infected with Delta, the amount of virus that you have remains about the same, although you don't get as sick. But the fact that you have that virus there means that you can transmit it. And so again, remember that masks probably do a reasonable job protecting you, but they do a really good job of protecting other people if you're infected. So we need to continue to wear masks.
All right. Well, thanks so much, Dr. Jerome Kim, for joining us on NDTV.
Thanks.